Hello, I'm Jenny Barrientos from Cameron County 911, and this is Texas County Voice, a podcast for all 254 counties. Thank you for listening.
Hello, and welcome to Texas County Voice. I'm Jody Seaburn with the Texas Association of Counties. On today's episode, we're clearing up some of the confusion surrounding Medicare and helping you better understand your options as you prepare to enroll.
Your lifestyle is different from your friend's lifestyle. Your financial situation could be different than their financial situation. So you need to find the plan that fits you.
About 70 million Americans are enrolled in Medicare, and that number continues to grow as more baby boomers reach retirement age.
What I'm seeing is people are thinking about retiring. So they're going to have a large number of people that are still retiring in that boomer age.
Today, we're joined by TAC Employee Benefits Specialist Rashawn Collins and Casha Hill, who will help demystify the Medicare enrollment process and explain some of the most common challenges people face when choosing a plan. This has been one of the most popular topics this year at TAC events like Healthy County Boot Camp and the County Management and Risk Conference. Rashawn and Casha sat down with TAC Communications Specialist Angela Maldonado to discuss the different Medicare plan options, what to expect during your enrollment call, and how to choose coverage that best fits your needs.
Who is eligible for Medicare and when do you enroll?
That's a great question. Individuals who are eligible for Medicare are people age 65 or older that are U.S. citizens or permanent residents who have lived in the U.S. for at least 5 years. You can also be considered eligible for Medicare if you have a disability, if you're under the age of 65, or if you have a chronic health condition such as end-stage renal disease requiring dialysis or a kidney transplant, among other things. Also, if you are automatically enrolled in Medicare when you begin receiving Social Security disability income, also known as SSDI.
Rashawn, you have kind of an insider perspective. You used to be a Medicare sales manager, and this topic was also a popular presentation at our conferences. I was there, the room was packed. How did that presentation come about, and why do you think it got such a great reaction at those conferences?
The biggest thing about having that packed house at the conference was a lot of the individuals there, they've heard of Medicare, but they weren't familiar with how Medicare works, how they're able to help their employees navigate some of Medicare. So when I first came on the TAC, one of the first things I wanted to do was to put together a presentation for our groups, for our team, that they could use as a guide when they're going out to the different groups to give a Medicare presentation. And I believe putting some of those things together has helped quell some of the anxiety, some of the stress that many of our members do have when they're considering retiring.
And what kind of challenges did you come across in this role when it comes to Medicare?
I think one of the biggest challenges of Medicare is the same as you get with employer groups is people don't understand the benefits. And so it is important to make sure people are educated in the basics, copays, deductibles, coinsurance, and a couple of things of what's included with a Medicare Advantage plan. What do you get with original Medicare? What do you get with a supplemental plan? Those are three different types and pieces of Medicare, and you can only have one of those three pieces. So having that understanding and being able to teach that can be a challenge, but I think it's also a benefit because people need to have that understanding of what they're getting into with Medicare.
An interesting statistic that I found was basically the amount of people signing up have been slowly increasing as baby boomers reach retirement. What does that mean when it comes to how people are using Medicare and also just what you've seen with the counties you support?
Absolutely. So I'll start with the counties that I support. There have been many counties, about 3 to 5 that I've presented this Medicare presentation to, along with doing it at our conference. What I'm seeing is people are thinking about retiring. So what that does is that gets the ball rolling, gets the wheels spinning, gets them thinking, what is this Medicare thing that I have to sign up for? When do I sign up for it? So those are some of the basic questions that come up, which we've answered currently. But I think the biggest challenge that is going to be out there with the boomers is they have the largest number of people that will enroll in Medicare by, I think they said 2030 or 2035. So they're going to have a large number of people that are still retiring in that boomer age because they're not retiring at 65. They're working till 70, 75 years old. So what that essentially means for them is they can elect Medicare Part A, which is your hospital, and that has a 0 monthly premium. What they're actually doing is they're delaying their Medicare Part B, which does have a monthly premium. And because with our groups, many of our groups, the counties are paying for their contribution for their insurance, it really does make sense for them to delay that Part B that they don't have to pay for.
That brings me to my next question. What are the differences between Medicare Advantage and Medicare supplement plans?
Absolutely. A Medicare Advantage plan is essentially a plan that you're going to get with one of the insurance carriers. So that could be Blue Cross Blue Shield of Texas, United Healthcare, Aetna, WellCare. Some of those are the carriers for a Medicare Advantage plan. In addition, when you have a Medicare Advantage plan, there are other benefits included, such as dental and vision and your prescription drug plan. So you know that when you go to the doctor, whether you have an HMO or a PPO plan, which you can choose, you know that you're going to pay copays and you're going to pay the same thing every time you go to the doctor, hospital, have lab work, things like that. Under a supplemental plan, it's just what it sounds like. It is supplementing your original Medicare to help pay those costs that you may incur. It's typically up to 20%. So it's what's called an 80/20 plan. Medicare is going to pay that 80%. The benefit plan would pay the other 20, or you would be responsible for the other 20, depending on the supplemental plan you receive. So I'm not talking about a County Choice Silver plan. I'm strictly talking about on the open market if you go for a Medicare Advantage plan or a supplemental plan. Now, going in further detail with the supplemental plan, if you are to elect a supplemental plan, that does have a monthly premium, but it does not include your dental, vision, or your prescription drug plan. You have to pay for all of those things separately, in addition to your Medicare Part B premium. So essentially, you're paying for 5 different things every single month on top of you having to still live, if you will. So you still may have a mortgage or rent you need to pay, car note, car insurance, different things like that. Those things can all add up when you have a supplemental plan. So I would say this: supplemental plans versus advantage plans, they are all based on your financial situation, and everyone's situation is different. I would also say this in regards to supplemental plans. If you're going to do a lot of traveling, they are beneficial to you because it's pretty much an open network. Most doctors are going to accept Medicare, so you can go to almost any doctor in the country. So you have a benefit there of having original Medicare, which is your red, white, and blue card, and a supplemental plan through one of the carriers. But again, having to pay for everything differently, a la carte, if you will, can be challenging for some people. So the Medicare Advantage plan could be more beneficial based on your lifestyle, based on any health challenges that you may have. And most Medicare Advantage plans, about 95 to 98% of them, have a $0 monthly premium, but you are still responsible for any associated copays or coinsurance for your medical care.
You never know what someone's situation is, and one may be a better fit.
Absolutely. And I'll say to that, and my mom has Medicare. And so when you become a person of Medicare age to have maybe a fixed and or limited income, those choices are very critical if you are someone that has any health issues. Even if you're pretty healthy, if you take prescription medication, which plan is going to benefit your lifestyle and your financial needs. That is the most important thing when selecting one of these plans on the open market. And you also want to have a reputable broker that's going to do their due diligence for you when it comes to these plans under a Medicare Advantage or a supplemental plan as well.
That is definitely a lot to keep in mind. So
It
I can
is.
see why people are kind of confused or there's so much information.
I've heard this from several groups. I've also heard this when I was a manager. I talk to my friends, and my friend has a supplemental plan. So I want a supplemental plan. Be very careful when you say you want that supplemental plan. Again, your lifestyle is different from your friend's lifestyle. Your financial situation could be different than their financial situation. So you need to find the plan that fits you, not based on what your friends have, your neighbors have, or any of your family members. If they have Medicare and or an Advantage or a supplemental plan, you have to find what fits you. So don't get something based on fitting them or what they have.
I feel like for the most part, when people think about insurance, it's kind of like, oh, I just opt in. This is kind of the general plan I have. And it's very kind of a broad picture. And now you have to flip and be very specific and be very kind of drilled into the numbers and what your needs are medically. When before it was just like, okay, as long as I get my check-ins or an eye exam, and just having to get really specific could be overwhelming for somebody having to do that.
It can, and I think one of the biggest benefits that we offer at TAC is being able to have us as consultants come to your groups, come to your offices, and make sure that we kind of push away some of that anxiety. But we want you to continuously ask questions as you get closer to that retirement age, right? Because it's very important that you understand the eligibility, you understand the enrollment periods, different things like that when it comes to Medicare. But I think by having us as your consultants in our designated territories, and there are 5 of us, that we can answer those questions. And if you have more questions, if you are the HR director, the treasurer, auditor, whoever's in charge of the benefits, you get those questions answered for your population.
When you're talking to people in the counties you support, Cachet, how does a person continue insurance if they resign or they're terminated from the role? Or what if the county doesn't offer pre-65 benefits for insurance?
Now, if we have someone who is retiring that is pre-65, we have two scenarios. Either their coverage is no longer going to continue on the plan if the county has not elected to continue to offer pre-65 benefits to their members, or we have some counties that do offer the option for their retirees that are pre-65 to continue coverage on the plan. So it's very important that you take a look at your county policy, county plan that is set up to determine if you're still eligible for coverage. But those are the two scenarios in which a member could potentially continue coverage or not be offered coverage once they retire. So, if you fall in the category of being a post 65 retiree, you will also want to take a look at the county policy and what they offer, because some counties do offer post 65 benefits to their retirees and some don't. Some also offer the option to enroll in what TAC offers as the County Choice Silver Plan. That is completely separate benefit offering and program that's offered through TAC than when you would continue traditional coverage on the county policy through Blue Cross. You definitely want to make sure you're pre-planning for your retirement before you actually make the decision to retire, because it's very important that you coordinate your dates on when you're going to retire, because you don't want to end up with like a lapse or a gap in coverage if you're retiring pre 65, right? And
Mhm.
you're maybe like 63 and you're not quite 65 yet, but you're retiring in at 63, and maybe your county doesn't offer a post 65 plan. So you just want to make sure that you're looking at your dates and pre-planning your retirement event.
And finally, when people are getting ready to turn 65 or even kind of approaching that age, they get calls, they may see ads on, their web browser or on social media. What are some of the things that people need to keep in mind about getting those calls or the information that they give to the person helping them sign up? What can they expect?
That's a great question because we're in the day and age of technology, social media, and you're not sure what you're seeing. So I'm going to answer that question, but I want to back up just a little bit because one thing that I want to mention is when you should enroll in Medicare. Medicare gives you a 7-month window to enroll. So you have 3 months before you turn 65, 3 months after you turn 65, and that includes your birthday month. So that's when you can enroll into Medicare. The best thing that I can say when it comes to getting these calls is make sure you're doing your due diligence as far as who you're speaking with. There are a lot of broker houses that facilitate Medicare Advantage plans, Medicare supplement plans. What needs to happen on that call is what's called a needs analysis. This call can take anywhere from 45 minutes to an hour and a half. The reason why the calls take that long is due in part to a lot of Medicare beneficiaries have a lot of doctors, have a lot of prescriptions. So let me give you the way a call should go. You talk to someone, they're going to go through 3 disclaimers with you at the beginning or at the in the middle, just depends on the carrier, but they have to go through these 3 disclaimers with you. One of those disclaimers is a permission for them to call you back if the call gets disconnected. The second thing they're going to do is they're going to ask you some qualifying questions in regards to things like TRICARE, if you have Medicare Part A and B. They want to make sure you have Medicare A and B before you get onto a Medicare Advantage plan. The next thing they're going to do is go into that needs analysis. They're going to ask you about dental. They're going to ask you about vision. They're going to ask you what your needs are. They're going to ask different questions like that. It's probably anywhere between 5 to 7 questions. Okay. After that, they're going to ask you, who is your doctor? Who's your primary care doctor? Do you see any specialists? This is important for a Medicare Advantage plan because if your doctors aren't in network, that plan doesn't benefit you. Okay. So we want to do our due diligence as Medicare sales agents to make sure that you get a plan that has your doctors covered, every last one of them. So if you have 3 doctors or you have 20 doctors, that agent wants to know who those doctors are. And the good thing about this is I'm preparing you for how a call will go. So if you hang up on someone, I don't want it to be my fault that I didn't give you the information. The second thing they're going to want are your prescriptions. Okay. You're not providing PHI. You're just telling them the name of the medication, how many milligrams it is. We don't need to know how many times a day you take it. We don't even need to know what the medication is for. But there will be Medicare beneficiaries that will tell you what it's for anyway. That's quite okay. The reason why we want this information is because if a medication isn't covered, that plan doesn't benefit you. If you're taking 2 or more medications and those medications are on a tier 3, 4, or 5, those medications could have a co-insurance or higher copay. So having all of this information has the agent to tailor a plan that fits your needs the most. So that information for your doctors and your medications is vitally important to that call. Now, they're going to take about 3 or 4 minutes to put you on hold. They're going to find a plan with one of the carriers. Again, these plans are going to have dental, vision included, and your prescription drug plan will be included with your medical as well as a hearing benefit also. That's also included with this plan. So they're going to ask you questions about hearing aids, dental, vision, all of those things. So once they find that plan, they're going to go over the full benefits with you. This is a Medicare requirement. It's required by Centers for Medicare and Medicaid Services, CMS. They require every agent to go through every single benefit with you. If you have questions on those benefits, please ask. Okay. After they go through those benefits of medical and prescription with you, and if there are any additional benefits available, they'll go through that. Then it's time to go to the application. All right. You need to stay on the line for the full application. You have to consent for the application. They're going to go through a bunch of disclaimers with you. The full application process takes maybe 15, 20 minutes to get through all the disclaimers and to verify your demographic information. At the very end, the agent will either read the final 3 disclosures or disclaimers to you, or they will play a recording for you. You have to sign this application with your electronic signature by stating your full name and your date of birth. That call can take anywhere from 45 minutes to an hour and a half, depending on your doctors, depending on how many medications you have. So I want you all to be very aware that this call is not a short call at all. So if you see something on TV, if you see something on social media where they say it only takes 2 to 3 minutes, that is incorrect. That 2 to 3 minutes is essentially a buffer for the initial agent you talk to get you to licensed sales agent to get you onto a Medicare Advantage plan that's going to fit for you. So that's really the premise of how a Medicare Advantage call will go. It's a lot. And so having this information beforehand, it will prepare you. So if you do not have 45 minutes to an hour and a half to enroll, don't complete that call on that particular day, because it is a sales call to get you onto a Medicare Advantage and or a supplemental plan. Some companies will do both. Some companies do one or the other.
Thank you, Rashawn Collins and Casha Hill, for joining the podcast. TAC member counties can contact their employee benefits specialist to learn more about enrolling in Medicare. Texas County Voice is a production of the Texas Association of Counties, about the people, issues, and all things important to Texans and Texas counties. To learn more about Texas counties and the Texas Association of Counties, visit county.org. You know, every county has stories worth telling, and those stories come from the people doing the work every day. That's why the Texas Association of Counties created Texas County Storytellers, a campaign focused on sharing the experiences of county officials and employees from across the state. If you've got a story about serving your community, we'd love to hear it. Just visit county.org/storytellers or send us an email at storytellers@county.org. A quick reminder, if you haven't registered for this year's legislative conference yet, now's the time. Discounted registration rates end August 6th. Join county leaders and legislators from across Texas August 26th through 28th at the Fairmont Austin. It's a great opportunity to connect with colleagues, hear from experts, and talk through the issues important to counties. You can register and learn more on the events calendar at county.org.